My name is Kayla Badia, and today I'll be discussing the United States opioid crisis. I wanted to start off by having you pause the video and answer the question on your screen. What are some characteristics or descriptions that come to mind when you think about an addict? Take a minute or two to write down 1 to 4 things. Once you're done, continue with this video. Welcome back. There are some things that I wanted to share with you. When I think of an addict, I think of a loving mother who was family-oriented, a woman who was generous and creative, an emergency room staff member, and a volunteer firefighter. All of what I wrote down describes my Aunt Diane, who passed away from an opioid overdose back in 2014. It is easy to place blame on addicts for their addiction to opioids. I can't blame anyone for doing this, as I have been guilty of this myself. However, it wasn't until I learned about the circumstances of my aunt's addiction that I was able to do a complete turnaround in how I thought about this issue. I invite you on this journey with me. My aunt didn't make the choice to take opioids. It was a result of a botched surgical procedure that left her with acute pancreatitis. After the procedure, her doctor gave her an immense amount of Dilaudid in the hospital, and when he discharged her, he prescribed Percocet each week, hundreds of pills, for years. Keep in mind, this was in the late 1980s, early 90s. So at the time, pharmaceutical companies were providing reassurance to the medical community, claiming that patients would not become addicted to prescription opioid pain relievers. And as a result, healthcare providers began to prescribe these at great rates. So, what are some implications of the opioid crisis today? In 2018, there were 10.3 million people that misused opioids. It is estimated that roughly 130 people die each day from an opioid-related death. In 2013, 15% of high school seniors reported taking prescription drugs for non-medical reasons, and 70% of them received these drugs from family members or friends. 50% of heroin addicts have abused opioids previously. This can be attributed to both of these types of drugs utilizing the same chemical pathway. I'm not sure if you knew this one, but according to the CDC, you're more likely to die from an accidental opioid overdose than a motor vehicle accident. As you can tell, this is a widespread and systematic issue. So how do we go about addressing this? Well, first thing that I tell anyone who's advocating for change is that they should identify their stakeholders. Some stakeholders that I was able to identify in this situation was the addict and their family members, pharmaceutical companies, practitioners, veterinarians, and first responders. Addicts and their family are included in this for obvious reasons, as the problem directly affects them. Although you may not think it's a good idea, it is important to get some insight from pharmaceutical companies in this conversation so that they can provide a view into their business, how it's run, and their willingness to follow regulations and the like. Practitioners are key players as they have the ability to prescribe opioid medications and have been doing so for decades. Veterinarians are another stakeholder that you may not originally have thought of. However, veterinary medicine can be directly affected by policies regarding opioids and other substances. An example of this is in 2019 when the Virginia General Assembly passed a bill that classified gabapentin as a Scheduled 5 substance, which went into effect on July 1st, 2019. For some background on gabapentin's use in veterinary medicine, it is an anti-seizure and pain medication that is used to treat seizures and chronic pain, such as nerve pain. It is also used as a temporary treatment for fear and anxiety for pets before stressful events. However, this new law has affected the quantity that veterinarians are able to prescribe at the time of the appointment. Finally, first responders should have a say, as they are generally the first ones on the scene for a lot of these drug overdoses. They have firsthand accounts on the levels of Narcan that are currently used within the communities, and sometimes even have established relationships with members of these communities. And once we have identified our stakeholders, it's important to ask ourselves, to what extent is this preventable? The short answer is this is absolutely preventable. However, it is important to note that this issue is multifaceted and will require a combination of surveillance, regulation, patient counseling, non-prescription treatments such as acupuncture, pain management, and physical therapy, and investments in effective treatment programs. But how does policy fit into this? On this slide, I have identified some key policies and programs that can be put in place to combat the opioid epidemic effectively. As far as prescription surveillance, an expansion on the federal level can assist in monitoring prescription drugs from state to state through an electronic system, which can determine the number of physicians who prescribe opioids for each patient and the number of pharmacies that opioids are dispensed for that patient. Although data is limited, the data that we have available indicates that these programs are successful in reducing opioid abuse practices, such as pharmacy and physician shopping. Educating practitioners is important, and the CDC currently does have a training program on their website for physicians where they can go over effective and appropriate opioid prescribing that focuses on dosage, treating pain without opioids, as well as reducing the risk and identifying opioid use disorder. Educating students about substance abuse in schools is also important to prevent opioid misuse among teens. There's been evidence-based programs that have been delivered in the school settings, and it has been reported that these have created a positive and safe environment for students. In these programs, students and their families can be educated on the dangers of drug addiction and the promotion of preventative practices for misuse of prescription drugs can be implemented. In addition, the government can invest in effective treatment programs for opioid abuse. Buprenorphine and methadone are considered essential medicines according to the World Health Organization and are commonly used for medically assisted treatments to decrease opioid use and opioid-related overdoses, deaths, criminal activity, and infectious disease transmission. After buprenorphine became available in Baltimore back in 2009, the heroin overdose deaths decreased by 37% during that study. Although these practices do have merit, it is important to note that these programs will not go without resistance. Pharmaceutical companies may not be on board with more restrictions against controlled substances because that's where they make their money. This is why it is important to get them on board when discussing them during evaluations of stakeholders and see if they will invest in medications that are used for treatments of opioid addiction. Another aspect is parents may not want their children to learn about substance abuse in schools. However, bringing them into the conversation of how it can prevent and mitigate prescription drug misuse could get them on board. Overall, the main thing that we're going to have to get past is the stigma of opioid addiction and seeking medical treatment. The hope is by educating practitioners, students, and their families that it will open up dialogue to normalize speaking up and asking for help when struggling with addiction. It is important to note that there was a decrease in opioid-associated deaths between 2017 and 2018. However, there are some concerns that the current COVID-19 pandemic has led to a worsening of the opioid epidemic in the United States. Overall, we currently have yet to see the lasting implications that this current pandemic will have on the opioid crisis, but we should be able to take our part in tackling this big issue because one life lost to opioid addiction is one too many.